The World Health Organization is now recommending GLP-1 drugs for adults trying to manage obesity, and that includes drugs like Zepbound and Wegovy.
This is a pretty remarkable shift from how the WHO has historically approached obesity, calling the therapies a, quote, scientific breakthrough, but says it's not a singular answer, adding that combined with a healthy diet and physical activity, this can be an effective long-term treatment. NBC News medical contributor Dr. Natalie Azar joins us now. Dr. Azar, this is interesting because these GLP-1 drugs have really changed almost every aspect of our society, to what we consume, how we socialize. I mean, how does this change things, though, for the patients? Does this sort of broaden the fight against obesity?
Yeah, and you know, I think, Morgan, we'll see just how much of an effect it happens or what kind of an effect it'll have over here in the U.S., where we're still trying so desperately hard to get commercial insurances to cover the medications for patients, for Medicare to cover the medication for obesity only. But certainly I think that this declaration from the World Health Organization really does illustrate just how much there's been this conceptual shift in how we think about obesity as a very complex disease that is contributed to by genetics, as well as environment, and of course lifestyle factors, but not only lifestyle factors. You know, for decades, the idea regarding obesity was really that it was a behavioral failure, that you were eating too much and not exercising enough. And now there's been a significant, you know, development and evolution in how we understand obesity as a chronic disease.
And Dr. Azar, let's talk cost and access. The Trump administration has actively looked to lower the cost of these drugs for Americans. Now the WHO is saying we should do this globally. Do you think this will push down prices even more?
You know, I think it will, Vicki, but just how much, I think, remains to be seen. You know, the new Trump negotiated deals with Lilly and Novo Nordisk will go into effect apparently sometime in 2026, although Medicare pricing is already established for 2026. We know that Ozempic and Wegovy are on the 15 drug list for the 2027 year from the Inflation Reduction Act. So a lot of moving parts there. You know, certainly a decrease from $1,000 to $350 a month is quite significant, but still will be cost prohibitive for a lot of people. The details need to get worked out on this, but I think that clearly there's a momentum to make these drugs more affordable across the board and globally.
Yeah, all right, we will see. Dr. Natalie Azar. Dr. Azar, thanks as always.
We thank you for watching, and remember,
the WHO, short for World Health Organization. But what does the name stand for, and what are the responsibilities of the agency? Well, the WHO is part of the United Nations, or the UN. It was created in April 1948 and is based in Geneva, Switzerland. Worldwide, there are 6 regional offices, more than 140 country offices, and about 200 cooperation and research centers. More than 7,000 people, including researchers, medical personnel, and professionals from all over the world, are working for the WHO. Decisions are made by the highest panel, the World Health Assembly, or WHA for short. As a UN agency, the WHO is partly financed by membership contributions. But donations by a variety of foundations are important as well. After World War II, sickness and disease were on the rise across the globe. So the member states of the UN decided to create a special agency. The goal? To guarantee the enjoyment of the highest attainable standard of health for every human being. And so, ever since its creation, the WHO does just that. It coordinates the worldwide fight against infectious diseases like AIDS, malaria, SARS, the flu, or COVID-19. One of its biggest successes was the global vaccination campaign against smallpox from 1967 to 1980. Thanks to this immense effort, the smallpox pathogen has since been completely eradicated. However, the more success they had at controlling infectious diseases, the more apparent it became that pathogens are not the only danger to human health. In 1988, obesity, smoking, and drinking were classified as major health risks. So the WHO is fighting infectious diseases, strengthening the healthcare systems of its members, and running vaccination campaigns. What is particularly interesting, despite its extensive reach, the WHO is hardly ever an executing institution. It merely defines norms and standards or consults governments in healthcare questions. Specific measures have to be initiated by the countries themselves. An exception to this rule is emergency relief in case of catastrophes. For example, following the last Ebola outbreaks, the Global Health Emergency Workforce was created in 2015 with the specific goal of being able to react even faster and more effective to outbreaks and humanitarian crises. And that is exactly why the WHO is so important. Because in today's globalized world, diseases and healthcare risks can only be taken on collectively.
The World Health Organization, or WHO, plays a crucial role in international public health. Founded in 1948, this specialized agency of the United Nations is dedicated to promoting global health, coordinating responses to health emergencies, and setting international health standards. Its overarching goal is to ensure that all people can attain the highest possible level of health. By providing leadership on global health matters, WHO is instrumental in shaping the health policies and practices of countries around the world. One of the primary functions of WHO is to conduct research and provide evidence-based guidelines for health practices. The organization collects data on various health issues, analyzes trends, and develops recommendations for countries. This includes establishing protocols for the prevention and control of diseases, such as HIV, AIDS, malaria, and tuberculosis. By disseminating this information, WHO helps nations prioritize health initiatives and resources effectively, ultimately saving lives and improving health outcomes globally. Another vital aspect of WHO's role is its emergency response capabilities during health crises. For instance, during outbreaks of infectious diseases like Ebola and COVID-19, WHO mobilizes international efforts to contain the spread of the disease. This includes coordinating with governments, funding agencies, and NGOs to provide necessary resources such as vaccines, medical supplies, and healthcare personnel. WHO's ability to act quickly and decisively is essential in preventing global health emergencies from escalating further. Additionally, WHO promotes health equity by advocating for policies that address social determinants of health. These determinants include factors like income, education, and living conditions, which significantly impact the health of populations. By addressing these underlying issues, WHO aims to reduce health disparities and ensure that everyone, regardless of their background, has access to necessary health services. This commitment to equity is pivotal in achieving the organization's mission of health for all. In conclusion, the World Health Organization serves as a beacon of hope and leadership in global public health. Through its research, emergency response capabilities, and focus on health equity, WHO is dedicated to improving health outcomes for people worldwide. As we face new challenges in public health, the continued work of WHO remains critical in guiding international health policy and ensuring the well-being of all communities. By understanding the vital role of this organization, we can better appreciate the collaborative efforts needed to build a healthier future for everyone.
The Food and Drug Administration, commonly known as the FDA, plays a crucial role in safeguarding public health in the United States. Established in the early 20th century, the agency is responsible for regulating food, pharmaceuticals, medical devices, and more, ensuring that they are safe, effective, and properly labeled. Its wide-ranging influence touches nearly every aspect of consumer health, making it one of the most important federal agencies in the country. One of the primary functions of the FDA is to evaluate and approve new drugs before they can be marketed to the public. This process typically involves rigorous clinical trials that test the safety and efficacy of a medication. The agency reviews data from these trials, examining potential side effects and determining whether the benefits outweigh the risks. Only after thorough scrutiny does the FDA grant approval, allowing the drug to enter the market and be prescribed by healthcare providers. In addition to overseeing pharmaceuticals, the FDA also monitors food safety. The agency conducts regular inspections of food processing plants and enforces regulations that help prevent foodborne illnesses. This includes ensuring that foods are properly labeled, free of harmful contaminants, and produced in sanitary conditions. By enforcing these standards, the FDA helps to protect consumers from unsafe food products that could pose a significant health risk. The FDA's role extends beyond food and drugs. It also regulates medical devices. From everyday items like thermometers and contact lenses to sophisticated machines such as MRI scanners and pacemakers, the FDA ensures these devices are safe for use. The agency evaluates the technology and performance of these devices, requiring rigorous testing and validation before they can be sold. This vigilance helps maintain high standards for medical technology, ultimately improving patient care and safety. Finally, the FDA also plays an important role in public health communication. The agency provides guidelines, educational materials, and updates on health issues to keep consumers informed. Whether it's a new nutritional guideline, updates on drug recalls, or information about emerging health threats, the FDA acts as a reliable resource for the public. By promoting transparency and educating consumers, the agency helps empower individuals to make informed health choices. In conclusion, the Food and Drug Administration is a pivotal institution that impacts our daily lives in many ways. Through its stringent regulatory processes and commitment to public health, the FDA works tirelessly to ensure that the food we eat, the medicines we take, and the devices we use are safe and effective. Understanding the agency's role can help consumers appreciate the safety measures in place to protect them and their families.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases, and we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell.
The World Health Organization has very painful decisions to make, according to its chief. He described the large, sudden drop in funding in US foreign aid as severe. The United Nations Health Agency has no choice but to slash jobs and operations.
The refusal of the U.S. to pay its assessed contributions for 2024 and 2025, combined with reductions in official development assistance by some other countries, means we are facing a salary gap for the 2026-27 biennium of between $560 and $650 million.
In addition to stopping contributions, the Trump administration plans to fully withdraw from the organization next January. In remarks to member states, the WHO chief Dr. Tedros said they would be saying goodbye to a significant number of colleagues. He said the funding gap represented about 25% of staff costs, but stressed that did not mean a 25% cut in the number of positions. The leadership team in the organization's headquarters will be reduced, and there's a possibility some WHO offices in wealthier countries will be closed. The agency, which coordinates the world's response to health emergencies, prevents disease and expands access to healthcare, needs to reduce its activities and recenter on its core functions. The news comes shortly after WHO member countries finalised an historic agreement to help prevent the next pandemic.
The World Health Organization is the United Nations global health agency whose mission is to promote health worldwide. The World Health Organization, or WHO, was founded in April of 1948, and it is made up of 194 member states. It is based in Geneva. The World Health Assembly is the supreme decision-making body for WHO, which meets annually and is attended by delegations from all WHO member states. It focuses on a specific health agenda prepared by the executive board. About 1/4 of the WHO's budget comes from country and NGO membership fees. The rest comes from voluntary contributions by donors and member states. The WHO has played a major role in eradicating and controlling serious diseases, including smallpox and malaria, and other tropical diseases. It has been successful in tackling polio and AIDS as well. However, the WHO was forced to make major reforms after it was accused of grossly underestimating the scope of the Ebola outbreak in West Africa between 2013 and 2016.
New tonight, the Trump administration rejects a series of international health policies proposed by the World Health Organization. The WHO says the proposals are designed to help prepare countries for future pandemics. That includes more clearly defining the term pandemic emergency and adopting plans to give developing countries better access to medical products. In a video, U.S. Health Secretary Robert F. Kennedy Jr. voices concerns about these proposals and another that aims to establish a communication plan in the event of another pandemic.
They require countries to establish systems of risk communication so that the WHO can implement unified public messaging globally. That opens the door to the kind of narrative management and propaganda and censorship that we saw during the COVID pandemic.
WHO member states have until next week to vote on the amendment.
After 3 years of negotiations at the World Health Organization in Geneva, and after a final marathon session late into the night, all 32 pages of the proposed pandemic agreement were highlighted in green, a sign that the text had been approved by all member states. The deal was sealed at around 2 o'clock in the morning, and quickly, as noted in red on the screen, countries lined up to give their congratulatory remarks.
I can see a very long list. Do you know that there is champagne outside? A bit French.
While the final document must still be ratified at the WHO's assembly in May, the deal aims to ensure fair access to drugs and vaccines globally, if and when there is another pandemic. It requires nations to set up national policies for research, local productions of vaccines, and greater oversight of global supply chains.
We have achieved an impressive work that has led to an historic step forward.
American negotiators were not present for the final talks, as Donald Trump has begun the process of withdrawing the United States from the agency. Nonetheless, getting to a final pact was a long slog. Much debate and hours of negotiations were spent on Article 11, which defines how pandemic health products and technology are transferred toward developing nations.
By reaching this milestone together, you have made history and shown how powerful collaboration can be. Multilateralism is alive and well.
In its 75-year history, this is just the second time that the WHO has reached a binding agreement, following an accord on tobacco in 2003. The pact is all the more pressing with global health threats always looming, be it bird flu, measles, Mpox, or Ebola.
Down. Get down. Get down.